With the number of COVID-19 cases again on the rise in the United States, could we see a return to widespread restrictions? Hello, I'm Anand Naidu, and this is The Heat. Right now, nearly 30% of the U.S. population lives in an area considered to have high COVID-19 transmission. That's according to the U.S. Centers for Disease Control and Prevention. And what's driving infection is the highly contagious Delta variant.
The Delta variant now represents 83% of sequenced cases. This is a dramatic increase up from 50% the week of July 3rd. In some parts of the country, the percentage is even higher, particularly in areas of low vaccination rates.
To counter the new surge, Los Angeles County reinstated an indoor mask mandate for everyone, vaccinated or not. Meanwhile, England took a different approach as it copes with a powerful third wave of infection.
If we don't do it now, we've got to ask ourselves, when will we ever do it? So this is the right moment, but we've got to do it cautiously.
Nearly all COVID restrictions, despite new cases still surging, masking mandates, social distancing requirements, bans on large gatherings, all dropped. Personal responsibility is the new order of the day. Well, there is a lot to talk about. Let's get to our panel. Yaneer Bar-Yam is the president of the New England Complex Systems Institute. He joins us from Boston. From Jackson Hole, Wyoming, Devra Davis is an epidemiologist. Hillary Brick is the health correspondent for Business Insider. Joining us from New Haven in Connecticut. And from the United Kingdom, Chris Smith is a consultant clinical virologist at Cambridge University. Thanks to all of you for joining us. And Devra Davis, let me start with you. The Delta variant is now the dominant strain in the United States. The country was on a pretty comfortable path to recovery. We saw vaccination rates going up. We saw the number of infections going down, number of hospitalizations going down, and of course the number of deaths going down as well. But now we see numbers going up. Are we going to see restrictions being reimposed? How do health authorities combat this?
I think we are going to see more restrictions as we started to see in California. I think it's unavoidable and it's unfortunate. The pandemic has now runs the risk of becoming endemic because of the nature of the Delta variant and other variants that are looming right now. I think there's no question we're going to see more restrictions, and I think it's most unfortunate that the UK is taking the approach that it's taking right now.
Chris, what do you make of that? Is it unfortunate?
I think that the Prime Minister crystallised the sentiment and the situation quite well with his line, "If not now, when?" or words to that effect. Because we're offered an opportunity by the fact that it's summertime and viruses of all kinds of persuasions tend to spread much less well in summertime. It's also the end of the school year, so we don't have children in schools, and we know that schools are a giant crucible where lots of infections spread and change and then get carted off to the family home where other people who might be more vulnerable than children will catch them. And because it's summertime, we've got adults who are not at work because they are either on the tail end of working from home or they're off on holiday. So there's less pressure on public transport, there's less meeting in the workplace, there are fewer contacts between people. And this helps to counterbalance some of the risk that is engendered by having more people meeting more often. And while it looks like a scary approach to say, well, let's actually rip up the rule book and say that it's not against the law to do a lot of these things anymore, which it was previously, actually, what is happening is that people are being advised to take a cautious approach, but they're being reminded that 90% of the UK adult population have had one dose of vaccine, and nearly 70% have had 2 doses of vaccine. So we need to look at this not through the lens of what normally happens when you have 50 to 100,000 cases a day. We need to look through the lens of what happens when you have 90 to 95% of people who've been vaccinated not becoming severely unwell, even if they do catch coronavirus. And that's the difference.
Devra Davis, what do you make of that? Is that a fair case that Chris made there? I mean, the Prime Minister did say, look, we are lifting restrictions, but we are doing so cautiously.
I think it's perfectly reasonable to take that approach, so long as the public health message gets through that it's not business as usual. People do have to take precautions, as was just said. It's not a question of flipping the switch and we go back to normal. So I think that is sensible advice, but the concern that all of us have is that people have been so pent up for so long that they may overreact to the freedoms and assume that everything is back to business as usual, and it certainly cannot be while we have this pending situation with the Delta variant, which, as I think we all know, is also affecting those who've been vaccinated, although when you've been vaccinated and you get the Delta variant, you do not die of it as often.
Right. Yaneer, Bar-Yam, we're getting so many opinions right now, every day in the media and from other sources as well. There was a piece in the Washington Post written by a Harvard University professor, Joseph Allen. He wrote an opinion piece in which he said he's against mask mandates. He says vaccinated people should not use masks, and cases of vaccinated people contracting COVID are rare and not dangerous. What do you make of that?
So first of all, let me go back to what's happening in the UK, and it actually makes no sense what's being done. We have 1,200 scientists who have signed a letter in the Lancet saying what the UK is doing actually makes no sense scientifically, and surely not as a statement of values. Why would we have people get sick when we can prevent the disease? And indeed, the cases are growing rapidly. It's like saying, hey, we should ignore this raging fire that's happening in our house. Hey, when are we going to not ignore it? Let's just ignore it. So it doesn't make sense to not to prevent the disease. And going to your specific question, it is actually not true that the cases that happen after vaccinated are mild. The studies that have matched patients, matched people between vaccinated and unvaccinated, which was done in 1,600,000 people in Israel, show that the number of severe cases and the number of deaths for cases, the percentage, is actually the same between people who are vaccinated and unvaccinated. And even if there may be some small change in that percentage, it's surely not a substantial difference according to the available data. So this whole narrative that the vaccine makes the disease mild is actually not correct. And we know that the vaccination has now been shown by the Delta variant to be 5 times less effective in preventing transmission, according to the data in Israel. And we have events like 20 members of a choir fully vaccinated that met a couple of times, and 15 out of 20 of them became infected. So what we see is that there is a tremendous reduction in the ability of the vaccine to stop transmission, both because of exposure and because of the Delta variant.
Yaneer, just one point I want to get back to England on this, and that is the Prime Minister saying that, look, if not now, when?
Well, I mean, the question that we're facing is still the question of what is our overall response to the disease? Yeah. This idea that we have to live with the virus and therefore we need to relax restrictions when the virus is like a raging fire is very different from a different idea, which we could stop the disease. We keep ignoring the fact that it's been demonstrated that in a period of about 6 weeks, we can actually eliminate the virus, and then we can get back to normal. That's the when.
Hilary Brick, let's get to you. I read your piece in Business Insider, which you very considerately summarized for us, and this is your summary that I'm going to read now. You say vaccinated people who get the virus are well protected from severe disease. They can get COVID, but the symptoms will be mild. But you say the situation is precarious with a half-vaccinated population. That's, of course, the situation here in the United States. So, again, you make the case that getting vaccinated is crucial. It's the only way right now to prevent serious illness. But it's still a hard sell here, isn't it?
Yeah, well, I think it can be a hard sell, largely because, we tend to be not great at weighing the risks of things. So here in the U.S., we're seeing, hospitalizations are going up, but not largely in vaccinated people, whereas, most of the hospitalizations, most of the deaths are in unvaccinated people. And so over and over again, what the data is telling us is the risk of infection to an unvaccinated person is far greater than to a vaccinated person. I mean, there was a study out about Pfizer today showing it's 88% effective against symptomatic infections of all kinds. You can still get sick, but you're far less likely to end up with symptoms or end up in the hospital, and almost no chance of dying if you're vaccinated. So without a vaccine, you're taking a bigger gamble, and you're not giving your body a chance to mount defenses ahead of time and get ready for an exposure to the virus. But like I was saying before, we tend to be not very great at imagining our odds, whether it's odds of winning the lottery or odds of weathering a really bad COVID infection. So we always think we're going to get lucky, but we're usually not.
Devra Davis, here in the United States, workplaces are beginning to mandate vaccinations right now. Healthcare workers in New York, in fact, have been told that they must either get vaccinated or they must take a COVID test every week if they want to work right now. And we're hearing that some companies may, in fact, follow this protocol as well. Is this going to be the trend now if the economy is going to start to open up even more?
Absolutely. I think companies are within their rights and to require vaccination as a condition of employment, except for people who have extraordinary circumstances that would mitigate against it. And then those people, quite frankly, probably should not be in a general workplace. I think there's no question that we're going to need to be more vigorous in our enforcement of basic public health measures. And if we do that, we can still get a hold of this virus. But the problem is that it's not a protection, even if you're vaccinated. It's not a protection against getting COVID, particularly the Delta variant. There was just an outbreak in a homeless shelter in Santa Rosa, California, where of 90 people who were vaccinated, 30 came down with the Delta variant, and some of them became quite ill. So I think we have to recognize that vaccination should be required, but it's not enough. And in some circumstances, they're going to have to be mask wearing indoors as well, along with it, depending, again, on the profession and the nature of the work.
Yaneer, Bar-Yam, we are also seeing some movement as far as schools are concerned. Most schools in the United States will, of course, start the new school year soon. The American Academy of Pediatrics released new guidance supporting in-person learning and recommending universal masks in school, regardless of vaccination status. What is your feeling on this? Is this the right time for schools to reopen?
So the statement that masks should be required if people are together there's no doubt about it. But the challenge that we're facing right now is that with the Delta variant, we're basically back to where we were before, because the Delta variant, again, is more transmissible and the vaccines are less effective. So the combination of the two means that basically, if you do the calculation, you'll realize that the effects are canceling out against each other, and it's as if we were without the vaccine with the original variant. And what that means is that the experience that we had of very severe outbreaks with lots of people in hospitals is going to recur if we don't take strong precautions. Now, the question about schools, eventually people ask, what is the effect of school and transmission among children in that context? And again, people are ignoring the fact that children are affected very strongly by long COVID, the long-term consequences of the disease.
Chris, you disagree?
A lot of what we're listening to is this is absolute rubbish. And I just want to say a lot of what you're being fed here is just misleading. These vaccines are very effective. The data we have got is that there is a 95% rate of protection in older people against Delta. If you're vaccinated,
let me interrupt you for a moment.
You're 95.
Yaneer, I'll get to you.
Finish? We've been listening to you.
Yeah,
now
I'll get to you,
I'm going
Yaneer.
to speak.
Yeah. Go ahead.
Let me finish. Please be polite. We've shown there's a 20 times reduction in risk if people have 2 doses of the vaccine. To try to say that this is like being back to square one, where these vaccines just don't work, it's absolutely wrong. If you give people 2 doses of these vaccines, they are very effective at converting what would otherwise be a potentially lethal infection for some into a trivial infection for those people. And we've got a lot of data to support that. Now, long COVID, we don't even agree what long COVID is, and we do not know how many people really get this, but it's down in single numbers of percent. We also don't know how long it lasts for, but probably in the vast majority of people, this is a short-term thing, which if you have any kind of viral infection, you'll get some kind of post-viral syndrome. Now, we could protect children against long COVID. They have a very small risk of it happening if we give them vaccines. Some countries, the UK has decided they're not going to go down that route, but other countries are going down that route. But the risk of long COVID or the risk of any kind of consequence of COVID in young people is extremely low. And I think it's very important that people are not scared or terrified by a lot of misinformation and inflammatory reporting, which is unfortunately what you're doing.
Yaneer, Bar-Yam, go ahead.
Okay, so first of all, the studies that show a factor of 10 to 20 in reduction in cases in vaccinated individuals is no longer valid for the Delta variant. The data from Israel recently shows that it's only down by a factor of 3. And so that really has to be looked at
after
again.
one dose.
In particular, wait a second, that is the data now from Israel. It's been the last few weeks, and it's very clear. Now, in terms of the issue with the long COVID, there are studies in children, and children do get it. The percentage is about 20 to 40%, depending upon the studies. And indeed, the impact on children is definite and very clearly diagnosed. And there's the fact that there is organ damage among people that get long COVID is not a question scientifically. So to deny it is simply not to look at the data that is available.
Hillary, let's talk about misinformation. You're a journalist. You know what the challenges are. You face those challenges every day. We have a report on misinformation. Let's listen.
If you're unvaccinated, you are not protected. So please, please get vaccinated. Get vaccinated now.
An urgent plea from President Biden, imploring Americans to shed their doubts about vaccinations, with COVID-19 cases sharply on the rise.
The only way we put it behind us is if more Americans get vaccinated.
Dina Cranley and Barbara Lynch agree with the president, but they have a blunt reality check for him.
I don't think they're listening to the politicians.
Lynch and Cranley have spent months trying to chip away at vaccine hesitancy through their group First Ladies for Health, which does outreach to communities of color and faith.
We've come up against a brick wall, and we're trying to figure out what we can do now to induce people to get the vaccine. I have a grandson who is not taking the vaccine. He believes the stuff that he's seeing on the internet.
The Delta variant has highlighted a new divide in America, rooted in far more than politics. Bill Stearns, a lawyer in the conservative suburb of Batavia, got his shot early, but knows plenty of people who haven't.
The primary reason I'm hearing is that it's untested and they don't want to have anything like that in their bodies that they don't control.
In Cincinnati, 23-year-old Marquise Hughes told us he will not get the vaccination, despite pleas from his grandparents and others.
I just don't feel like it's safe. Can no one convince me.
Who told you it wasn't safe?
Myself, just my research.
So Hillary, there you heard it, someone who says they've done their own research. We've got amateur virologists now in the United States, and we heard the other person who said that he has concerns about the fact that the vaccine was not tested. President Biden has called out Facebook. He's hit back at Fox News as well. How big a challenge is it in the United States?
Yeah, well, I think, we're clearly seeing even today here that misinformation around the vaccines is a huge challenge. But, the data from hospitals is really showing, I just want to reemphasize what Chris was saying, that these vaccines are still effective, although less effective against Delta. And, misinformation online is a huge part of the problem. There was a recent report that found, just 12 people are responsible for most of the COVID-19 conspiracy theories online on places like Facebook. So it's a huge challenge, but it's also, coming from a very small number of people sometimes that's driving most of the fear-mongering happening. In journalism, we have a saying, if your mother says she loves you, check it out. And I think the same applies to whatever people see online. You should really probably, ask a doctor or a virologist or someone who knows what they're talking about.
Devra Davis, there are a number of people in the United States, as we are fully aware, who will not get vaccinated, some for political reasons, others because, as we just heard, they do their own research. And then there's a significant group of African Americans in the United States who are suspicious of anything prescribed by any government here in this country, and that's because of a legacy of abuse in the past.
Right.
I mean, could this unvaccinated group, Devra Davis, become a breeding ground for more variants of the virus?
Well, that's exactly what's happening. And in addition, we have the legacy of the Tuskegee experiment where men were allowed to have syphilis and go untreated until they died. And it's a dreadful, dreadful reminder of what public health unfortunately did with cooperation from experts, which is why in the Black and brown community, there's a lot of skepticism about what public health officials have to say. At the same time, we've seen, for the first time in recent history, a decline in life expectancy among Black and brown people because of the COVID impact. This is a reality. It's having a huge impact in precisely these communities. So I think that we need to do a better job of addressing the reality that there's real reasons for the skepticism in this community, and that they have borne a disproportionate brunt of the illness. They've been the first responders. They've been the ones who clean the hospitals, who provide the nursing care. And in the beginning, they got a much heavier burden of the disease. And I want to go back to a comment that was made. The damage from COVID can be permanent to the brain and to other organs. And I think that we need to recognize that we're kind of like trying to fix a bus that we're driving in at the same time. We really don't have a lot of the answers, but we certainly know that the unvaccinated population is at huge risk for all of us, first of all, to themselves, but then to the rest of us for the potential to interfere with our ability to get back to a normal life.
Yaneer, Bar-Yam, what are your thoughts on this significant number of people in the United States who just say no vaccination for us?
There's no doubt that it's important to promote vaccination in people who are at risk of receiving of getting the disease. The ability to provide clear and careful explanation of the risks is a challenge in the context of a cacophony of voices that will present many different kinds of information. So we do have that challenge, and we should meet it by being consistent in communicating careful information about the nature of what risks are under these contexts. So vaccination is an incredible tool. It's an incredible help. Unfortunately, we haven't taken advantage of it as much as we should. And if we can combine it with the other precautions that we can take to prevent transmission, we could today dramatically decrease the number of cases rather than allowing the cases to increase as we are now.
Chris Smith, you know, when the vaccinations were first announced, this was months ago, 7 months ago, I think, one of the things we heard was that, you know, we need a certain number of people to get vaccinated to reach herd immunity. There was some kind of tipping point, a threshold that needed to be reached. I think at that time we heard numbers like 60%, then it was 70%, then it went back to 60%. Does that still hold true?
With a vaccine preventable illness, where once you're vaccinated, you're immune or judged to be immune, then the whole concept of herd immunity works. And the whole scope of this, and the whole idea of this, is that if you have a sufficient number of people in a population who can't catch an infection, then effectively the likelihood of a person who's got the infection bumping into someone who can catch the infection is so remote that you can't sustain a chain of transmission. And for things that are really infectious, like measles, you need to push the level of herd immunity, immune people, to about 90% for that to work. The problem with coronavirus is that the vaccines that we have do not stop you catching the infection. As we've been discussing on this program, you can still catch the infection. You don't become severely unwell. This means it's much more difficult to achieve herd immunity when the vaccines we have at the moment can't block transmission. They cut it down, possibly by as much as 75%, but they don't completely stop it. So people are more of the opinion that the best approach is to vaccinate as many people as possible, especially the vulnerable people, and then we will convert what would be a lethal and severe infection for those people into what is hopefully, 95% of the time, a more trivial infection, and therefore we save lives, but we know that we will not be able to exist in a zero COVID world. It's endemic, it's going to be with us probably indefinitely, but certainly for the foreseeable future.
Hillary, Dr. Anthony Fauci, whom we've seen a lot of in the past few days, in fact, over the past year, he was back in the news. He was in Congress testifying at a hearing there. He has talked about misinformation, and he said, if we had the kind of false information that's being spread now, if we had that back decades ago, I'd be certain that we'd still have polio in this country. Does he make a fair point there?
You know, I think he does to a certain extent. I think the one big difference with the polio virus that we have to remember is, you know, before the polio vaccine, the polio virus was crippling, you know, thousands of people every year in the US, and that's a very real, scary, visible consequence of infection. With COVID, we don't have that. There aren't, you know, you can't just see people walking around who've had COVID infections staring you in the face every day with some sort of, you know, visible, you know, problem now. And so, you know, in that way, I don't think some of these misinformation campaigns would have worked as well back then, because people were seeing the real consequences of what life with no vaccine was like every day. So people really wanted that vaccine, I think, because the risk of not being vaccinated was so obvious, and also because it was a very normal thing to do, to go get vaccinated. I was remembering my parents were kids at the time, and they rolled up to the bank, the drive-through bank, and the whole family just got their vaccine handed to them on a tray. So, you know, and polio vaccination is still very normalized today. Like pretty much every baby in the US gets it before their second birthday. So, you know, it's beneficial, it's safe, and it's normalized. And I think that's what Dr. Fauci was getting at. Like, the reason it's so effective at stopping infections is because basically everyone gets it. And that's really the only way to safely eradicate a disease is with widespread vaccination, which we don't have right now for COVID.
Okay, and that's where we have to leave it. Thanks to all of you for that very interesting discussion. That's it for this edition of The Heat. But the conversation continues online. Join us on CGTN America's Facebook page to comment on this or any other show, or chat with us on Twitter at CGTN America. I'm Arnold Naidu in Washington, D.C. Thanks for watching.